No, no, no.
And to go to the doctor, I'm going to go ahead and get my PowerPoint shared here. But we should have plenty of time for questions at the end, but feel free while I'm talking, we can keep this sort of informal to shout out a question if you would like. So I am Dr. Christine Hartford. I'm a pediatrician and I'm on faculty at NYIT College of Osteopathic Medicine in Jonesboro. And today we're going to talk about when to go to the doctor, but I really kind of wanted to expand on this just a little bit and not only talk about when to go to the doctor, but why it's so important to go to the doctor, especially when it comes to our well child visits, and also who to go to. And what I mean by that, I want to introduce the concept of the pediatric medical home. Now, I don't know if this is something you're familiar with or not. This term medical home is something that has been used more and more over recent years. But I'm just going to take a second to read to you a statement from the American Academy of Pediatrics. We actually have a policy about the medical home. So I just want to read this to you. The medical care of infants, children, and adolescents ideally should be accessible, continuous, comprehensive, family-centered, coordinated, compassionate, and culturally effective. It should be delivered or directed by well-trained physicians who provide primary care and help to manage and facilitate essentially all aspects of pediatric care. The physician should be known to the child and family and should be able to develop a partnership of mutual responsibility and trust with them. And I just love that. I think it says it all. And I think this concept of medical home maybe means different things to different people, but in general, you should find a clinic or a doctor for your child where you feel at home. The medical home should be the place that's always accessible to you. You feel like the doors are always open. You feel like you are always welcome. You feel like you are always listened to, and you feel like you can always depend on that medical home to provide you with the care that you need. And we're going to keep coming back to this concept throughout the talk. I hope that by the end, it's clear why it's so important to have this medical home for your child and how doing so can really improve the care that your child and your family receives. Now, in this medical home, we can think of different types of visits. We have our well child visits or our checkups, which you're all probably very familiar with having little ones at home. And we're going to talk a lot about the well child visits or our checkups. We also have our acute care visits or our sick visits. So things that come up, your child comes down with a cough or a fever, those things that need to be addressed relatively, I would say, more urgently. And then somewhere in between, we also have our what we would call our chronic care visits. So that might be, for example, a child who has asthma or ADHD who might need to be seen frequently for follow-ups for those types of issues. So the first thing I want to do is really focus in on these well child visits, because I think sometimes that there's a little bit of a misconception that the most important thing we do in our well child visits are our shots, but that's not really the case. The shots are very important. Immunizations, in my opinion, are one of the most important things we do to keep our children healthy, but there's so much more to that. And I really want to go into that today. So this, you are not meant to read this. I know this is very big and busy, but this is called the periodicity schedule. And this is from the American Academy of Pediatrics. And this basically outlines everything that we should be doing for each child when they come in for every single well child visit. So it actually starts at prenatal, believe it or not. You can go to your pediatrician for a prenatal visit, and I would encourage everyone to do that. But it starts with newborns and goes all the way up through age 21. And every single line on this chart is something that we should be doing. And sometimes I think that gets lost a little bit in our visits, and we're not so good about maybe conveying all the different things that we're doing and why they're so important. So that's why I really want to spend some time on that today. That schedule comes from, like I mentioned, the American Academy of Pediatrics. And the Bright Futures, I sort of think of this as our Bible for our well child visits. This book outlines for us not only all of those elements that we should be handling, but in more detail, but the evidence behind them. So those recommendations are evidence-based. They're based on science. They're based on what we know is best for children, and they're continuously updated. That schedule comes out, a new one comes out every single year. And although it might not change much from year to year, they're continually making sure that what we're doing is based on the best evidence and the best information that we have. This mission of the Bright Futures, again, I love this, is to promote and improve the health, education, and well-being of infants, children, adolescents, families, and communities. So we're interested not just in health, but also educating you, and not just in the child in front of us, but that child's family and community as well, because we know that those things, the family and the community that the child, in which the child lives and grows and plays and does everything, really can influence the health of that child. So it's our job to learn about all those aspects of the child's life. And the Bright Futures is what really outlines that for us. In terms of the well child visits, you all are probably very familiar with most of this schedule. I just outlined here every single well child visit that the timing that every child should have their well child visit. So very heavy in that first 2 years. Once we get to the third year, we want to see your child in the office at least once a year, every single year, all the way up through age 18 or 21 or whenever they move on to their adult physician. And I think we're all really good about those well child visits early on. But I think as our children age, especially if we're lucky and blessed to have children who are healthy, we might fall off a little bit with the well child visits as they get older. And so one of the things I want to help you understand is why those visits, even for the older children, are really important. Okay, so this, I'll move through this quickly. This just breaks down that big table into different sections. And what I'm going to do is go through each one of these sections with you to help you just kind of outline for you all the different components of that well child visit. So the first is measurements. This one is probably obvious. This one I think we do pay attention to because we're all very interested in knowing how our babies are growing and gaining weight and getting taller. But we pay attention to growth at every age. And there's a saying that goes around in medicine that children are not little adults, and that is so very true. But one of the main reasons and one of the main ways that they're very different from adults is that they're continuously growing, right? And so one of the most important things we do as pediatricians, especially during those early years, is pay attention to that child's growth. So we are measuring their height and their weight at every single visit. We're looking at that information to get our body mass index, which is something we pay a little bit more attention to as the children get older. That tells us about the child's weight and if they're entering that overweight or obese category. The other thing we measure and pay attention to is head circumference in our little ones up to age 2. So you might notice that your child's head is getting measured. And that's really important because it actually can tell us about your baby's brain. And if there's problems there, it might be with the head circumference, it might be the first signal or the first sign that we see that there could be like a neurodevelopmental problem. So here we're looking for growth problems, which could be failure to thrive, meaning babies who are not gaining weight the way they should, problems with maybe short stature, so children who are not gaining height the way they should, and then, like I said, obesity and also brain development. And I wanted to show you, these are growth charts, and I hope this isn't the first time you've ever seen one of these, but I want to walk you through it just to sort of make a point here about the medical home. This is what pediatricians use and look at to know if your child is growing the way he or she should be. So I'm just using an example. They are gender specific because boys and girls grow differently. So blue for boys, pink for girls. And we look at these growth curves for weight and length and head circumference, like I said. And if you've never seen one, I encourage you, when you take your child to the pediatrician, to ask to see the growth chart. These days, they're part of the electronic medical record, but it's one of the first things I look at each time I see the child for their well child visit, because it really is important. But I wanted to show you in this blue one over here, these pink dots. Each dot is that child's length every time they come in for a visit. And it's not so much being able to read this, but I wanted to show you that, if you look at this first dot, that child's doing great. If you look at that as a snapshot, one-time piece of information. If you look at the second dot, just as a one-time piece of information, that child is doing great. If you look at the third dot, just as a one-time piece of information, that child's doing great. But what's very concerning to me as a pediatrician, if you look at these dots, they're basically a flat line. That child is not growing. That child is not gaining in length or height. And by taking your child to your medical home, by finding that one clinic that you feel comfortable with, where you feel it's meeting your needs, and taking your child to their visits to the same place every single time, we get information like this that's incredibly valuable. Whereas if a different clinic was seeing your child each time for each visit, or you were going to different places, you might not have all of this information in one place where someone could look at this and have the big picture and really be able to understand that there's a growth problem here. So it's by having that one place that has all the information about your child, and that having a doctor who can look at the big picture, it's incredibly valuable, because problems like this with this child's length, for example, would get picked up much sooner rather than later. So that's really important. And I think the paying attention to the growth of especially infants and young children is one of the great benefits of having that pediatric medical home. One of the other measurements that we pay attention to is blood pressure, believe it or not, which I think a lot of us think is more of an issue for adults, but we actually start measuring blood pressure in children starting at 3 years of age. And we're looking for hypertension just with adults. And we're actually seeing more issues with hypertension in our children, in our pre-adolescents and adolescents. And I think that goes along with, we're seeing more children who fall into the obese category. So this is definitely something that we need to be paying attention to. We do measure blood pressure even in infants and children if they have certain medical problems like those listed here, but that's relatively, not as common. The next big category of things that we pay attention to in our well child visits is sensory screening. So that's our vision and our hearing. These are really important for children. And we pay attention to both of these throughout childhood, but there's specific time points where we should be doing, where it's recommended that we do actual specific testing. And this actually begins with infants, believe it or not. And it is very difficult. We can't really measure visual acuity in infants, but we're looking at, can they focus on things? Do they look at things? Do they track with their eyes? There's other ways that we can get a sense of the vision in a child. And then as our children get older, starting at age 3, we use the wall charts, which probably look familiar to you. And the specific time points that we're testing the vision are listed here. So you can see we do it fairly frequently in the younger children, but then still we should be checking continuously all throughout adolescence. We now have at our disposal what are called vision screeners, which are really, really great. They're equipment, they're devices that we can use to look in the children's eyes that will actually tell us if they have a visual acuity problem or if they are not seeing clearly. And they actually go down, we can use them down to the age of 1. So it's really helpful because it's allowing us to detect vision problems much earlier than we otherwise could, and which allows us to intervene and fix problems, address problems much earlier, which is really important for certain visual problems. As far as hearing, again, this is all throughout childhood. We should be paying attention to hearing, but at very specific time points, we do the actual audiometry testing where we have the child wear the headphones and see if they can hear different sounds. And it also begins with the newborn, whether you may be aware that your child has a newborn hearing screen before they leave the hospital. Hearing is really important for young children. If they don't hear well, they're not going to learn to speak well. So actually one of the first signs of a child having a hearing problem could be that they're not developing their speech the way they should be. So very important for us to pay attention to. And now we're actually seeing in our older children and our teens, I think from the use of the earbuds and music, we're actually seeing more hearing issues in the older children. So again, it's really important for us to keep doing this testing and paying attention even throughout our teenagers. The next big section is developmental and behavioral, and this is a big one. Just as children grow, children continuously develop throughout childhood, and this is another great example of why children are not little adults. They are born not knowing how to do very much, right? So, but they continuously and quickly learn new skills, and they should be learning these skills at fairly specific time points, and it's our job to make sure that that's happening. So we assess development at all ages, really, but really heavily focused on the infants and young children to make sure that they're doing things like sitting on time, rolling over, walking, learning their words, cooing, babbling, speaking. Is their speech, can we understand it? Those are all things we pay attention to. And we do this by talking to you. The parent, nobody knows their child better than a parent. And so asking parents what they're observing, asking parents if they have any developmental concerns. You may have had to fill out lots of questionnaires from the pediatrician asking you if your child can do various skills. And those questionnaires really are very helpful to us to detect to detect developmental problems, hopefully earlier, again, rather than later. And we also do this by just directly observing your child. So one of the great things about pediatrics that I love is that I really do get to play with my patients. And sometimes it might look like we're playing with the child, but actually a lot of things we do in that setting help us assess the child's development. Can they play peekaboo? Do they, how well are they talking? Can they run? Can they throw a ball? Can they catch? Those types of things are actually very useful to us from a developmental perspective. So again, we're looking for delays in motor or speech development. We're also assessing for autism at ages 18 and 24 months specifically. Of course, we can detect at any time, hopefully. And as the child gets older, the focus changes not so much on making sure they're gaining specific milestones, but we're looking more at how they're doing at school, for example. And then behavioral health, the other big section in this category, also very big. This could be anything from behavior problems that a child may be having, whether it's challenging behaviors, acting out at school. Also, emotional health falls into this category. So things like depression and anxiety, ADHD would fall into this category. This is something we are concerned about every time we see your child. And again, it's something that we talk to you about. As your child gets older, we also talk to them about these issues. This is sort of one of those things that we like to address and talk to children, sometimes by themselves. And you should notice as your children get older, I know most of you have little ones, but believe me, they're going to be bigger. It's going to go by, those years will be here before you know it. But usually around the age of 12 or so, we start to, as pediatricians, want to spend some time with the child alone and just try to ask them all different kinds of questions. But this is also one of the things we're looking at, the emotional health of the child. I just wanted to give you an example. We use a lot of questionnaires when we are assessing for behavioral problems. And this is just an example of one that we use, and we may ask you to fill it out. Depending on the age of the child, we may ask them to fill it out. And it's all kinds of questions you can see here. How often do they feel sad or unhappy? Do they daydream? Do they act if driven by a motor? Do they tease others, refuse to share? So this example, this particular questionnaire is very broad, but it includes questions that get at depression. It includes questions that get at potentially attention problems. It has questions that get at some sort of like behavioral problems, and it's just like the first step that we can use to just get a hint of if there's a problem going on. So you may see lots of different questionnaires along this line that we use to assess your child. Another thing that we are looking for as the children get older is substance use, usually around the age of 12 or so, or anytime there's concerns. And there are, again, questionnaires that are what we say validated for ages 12 and up. We know for our adolescents who, for the most part, are healthy, assessing them for mental health issues and risk-taking behaviors is one of the most important things we do, because those are the things that threaten their health more. So the leading causes of death in adolescence is actually not from medical problems, it's from injuries. So our job, yes, we need to pay attention to the medical problems, but we also need to be paying attention to the other things that could be harmful to them. So this falls into that category. And we may be asking you, again, we may be asking the child, and we're asking about, tobacco, alcohol, drug use. I should have put vaping on here because that's something that we're seeing more recently, but is really something we need to pay attention to. And finally, what falls into this category is just all kinds of psychosocial issues. And here, we're not just talking about the child, we're talking about the entire family that we want to know. Is there anything going on at home that really could affect the health of this child? And we do this by talking with you. And again, we have questionnaires for everything, but there are questionnaires that we can use to get at some of these issues. But we want to know if there's struggles, because we know that those issues have been shown to affect the health of children. So we're talking about everything from the emotional health of parents, any parents who might be struggling with substance use, any history of violence in the home, families who are struggling with food insecurity, home safety issues. Those are things that we know could affect the child. And so we want to know about them and help as best we can. I wanted to point out here the postpartum depression, because I feel very strongly about this. This is something that pediatricians should be, and I hope are, addressing. You know, if you think about it, when you have a newborn, you're in the pediatrician's office much sooner and much more frequently than you are in your own obstetrician's office. So pediatricians screen for postpartum depression at every infant well child visit up through 6 months of age, but now there's some suggestion that we need to be even doing it longer because lots of moms struggle with this issue. And you can imagine that a mom who is suffering from postpartum depression will really struggle to take care of her infant the best she can. So it's something that as the pediatrician, we want to be aware of and we want to help with. The next big section that I'm not really going to spend any time on at all is the physical exam. That should be fairly obvious to you. Every child should have a comprehensive head to toe physical exam at each of their well child visits. Procedures is the next big category. That sounds scary. That what we're really talking about here is the blood tests and immunizations fall into this category. And these procedures actually start with the newborns. There's several that are done in the hospital before your child even leaves. We have the newborn blood test, which is a screening test for lots of different congenital disorders. So for example, cystic fibrosis, sickle cell disease, some immune system problems, lots of different disorders that can be very harmful to the child, but if we know about them sooner, we can intervene to hopefully before the child becomes sick. And although that's done in the hospital, it's imperative that the pediatrician follow up on that and make sure that everything was okay. The other things that happen for our newborns is the hearing test, which I mentioned. We have a congenital heart disease test that we do now, which is really just checking the oxygenation with the probe on the finger and the toe. And then our bilirubin checks to look for jaundice, which some of you may be familiar with. That's a fairly common issue that we see in our newborns. And so although these things can be done, most of them are done in the hospital, there are things that the pediatrician will be following up on. The other blood tests that we need to do, we screen all children for anemia when they're 1 year of age. We screen for lead at 1 and 2 years of age, or anytime we are concerned that there could be an issue going on. And now in our older children, and this goes along with the obesity and the hypertension that I mentioned earlier, we are screening for dyslipidemia or checking for their cholesterol and their triglycerides. We do some infection screening when it's indicated. So tuberculosis for children who are at risk, as in our adolescents and teenage patients looking for sexually transmitted infections, testing for HIV and hepatitis C are all recommendations on that periodicity schedule. So talking to children as they get older and into that adolescent period about sexual activity is really important for us to be doing, and screening children who need it. And then it's recommended that everyone, all of us, are screened at least once for both HIV and hepatitis C. Moving on to immunizations, yes, these are incredibly important for our children. And I'm going to show you the schedule here in a second. The immunizations that we give are according to very specific guidelines that are updated every single year. The new schedule actually just came out, which is pretty much this. It doesn't change very much year to year, but it is looked at and updated year to year. The recommendations actually also contain very specific recommendations for how we what we say catch up. So if we have a child who's missed several immunizations or is just a little bit behind, how we get them caught up as soon as possible is very clearly outlined. And then there are also specific recommendations for children who have certain medical problems, such as immune system problems or other chronic medical problems. So children who may need additional immunizations that most children do not, or children who perhaps could not receive specific immunizations. And this is a lot. You're not meant to read this, but this is it. This is what we follow to make sure that every child is getting caught up, getting their immunizations on time and getting everything they need. So everything here in yellow is the time that children should be getting an immunization. the green is catch up, and then the purple is those children who might be getting things done a little bit differently because of certain medical problems that they have. And then the last thing that we look at is oral health. So we are not dentists, but we are concerned about the oral health of every child. And again, think about it, the children are seeing us much earlier and much more frequently than they are the dentist. So it's something that we should be paying attention to. So we start screening for risks in children at about 6 months of age, just kind of getting a feel for what the oral health of the family is overall, what are some of their feeding habits. One of the biggest things we need to do is just educate families. I think a lot of families don't realize that the recommendation is for children to get their first dental visit at around 1 year of age. So, passing along that information, and then helping everyone find their dental home is another thing that we should be focusing on, making sure all children are getting to the dentist. Some pediatric offices also do fluoride varnish now, which is actually really helpful, again, because it's something that can protect a child's teeth. And if you're coming into the pediatrician's office anyway, getting both things taken care of at once is really helpful. And then finally, anticipatory guidance, and that's just a fancy word for education, really. This is the pediatrician paying attention to your concerns, answering your questions. Sorry, of course, my computer's doing something weird right now. Answering your questions, and then giving you advice. And there is so much that we could cover, and it really depends on the age of the child. For example, in babies, we really should be focusing on making sure parents understand safe sleep practices and feeding practices, versus toddlers, how to baby proof your home, and bike safety as the child gets older, just reading to your child, sleep habits. There's so much that we can cover. So, a lot of this is done giving parents handouts or educational materials. And the way I approach it is, and we definitely don't have enough time to spend on this, that we, as much time as we would like, but I kind of, once I get to know a family and know the main issues that are going on with a family, then it helps me sort of pick and choose the things that I emphasize during this time of the visit and that I really focus on, and then the rest can be left to those sort of educational materials and handouts. But this is one of the really important parts of those visits. And before I move on to the more acute care visits, one thing that I forgot to mention when we were talking more about the behavioral issues and the psychosocial issues that we are interested in and want to know about, if you think about it, especially with our preteens and our teens, they're often not very forthcoming, let's put it that way, with lots of information, or might not feel comfortable speaking with a physician or other healthcare providers. And that's where I feel like another benefit of that medical home is, if your child is seeing the same physician over and over again and really gets to know them, I think that can go a long way with establishing trust and establishing a good rapport and relationship with the child, so that if they have issues later that they're struggling with, whether that be emotional issues or risk-taking behaviors, that they actually do feel comfortable talking with us and opening up to us, so that we are in that position where we can help them. I don't know, I could stop here and take a break and see if there's any questions about well child visits before we move on to acute care visits, or we can just keep going. What do you think, Brittany?
Oh, well, does anyone have any questions right now? All right, well, I say go on. You're doing a very good job.
Okay, so now I want to focus on acute care visits. So this is when our child gets sick. And what do we do when the child gets sick and we need them to be seen? And the way I look at it, the pediatric home is actually very important for this as well. But we have three choices, right, when our kids get sick and we need them to be seen. We have our medical home, we have urgent care, and we have emergency rooms. And the medical home, I would encourage you to use your medical home for these visits as much as you can. Now, that cannot be done every single time. And of course, if it's a true emergency, your child is struggling to breathe, they're not responsive, they've suffered an injury, of course, take them to the emergency room. But what and I think that is a fairly obvious decision for most of us. Where I feel a lot of parents struggle is when their kids have issues and they're not really sure. And maybe it's a fever at night or some vomiting and diarrhea, and you're worried, but you're really not sure what to do. And that's the situation where I would encourage you to use your medical home. Call your pediatrician, for a few different reasons. Number one, lots of times your physician or the office, whoever's on call, sometimes it's a nurse who's very skilled and knowledgeable in answering these questions, can give you advice and help you manage the child at home. They can hopefully reassure you most of the time, give you some advice to help your child feel better, and maybe perhaps see the patient in the clinic the next day if that's appropriate. Of course, there may be times where the child does need to be seen at night, and they sometimes can help facilitate that, sometimes give you advice on where to take your child. But we want to know. So if you end up having to take your child to an urgent care or an emergency room, calling us first, calling your pediatrician or your medical home first, and kind of talking things through with us, it's so helpful. We want to know if your child is seen in an urgent care or an emergency room. So I would encourage you, and the other thing I really don't ever want parents to be in that situation where they're home just worrying about their child. Like, we've all been there, and that's just not a place you want to be. And if you have a medical home, you shouldn't be there. Like, we would much rather you call and get some advice from us than be at home worrying about your child. So if you do not know how to contact your office after hours, find that information out and have that number handy for yourself at all times. Now, if you do end up needing to go to an urgent care or an emergency room, which definitely happens, I would encourage you to be proactive about asking them to say, this is my doctor, here's her number, please send the records to that office. Now, how often that happens, I think there's some issues in our medical system in general, and different parts don't talk to each other as well as we should, unfortunately. But sometimes that can be helpful. The other thing that can be helpful is if you end up having to go to an urgent care or emergency room. Well, first, if they tell you to go to a follow-up appointment, of course, do that with your pediatrician, but let us know. Don't be shy about calling the next day and say, hey, Dr. Hartford, I had to take Emily to the urgent care last night. I just wanted you to know, or I had to take her to the ER. That's something we would want to know. And then we can work on our end to be more proactive about getting those records, because we want to know, well, what tests were done? What were the results? What did they diagnose her with, and what did they tell you to do? And so it sort of closes the loop back to the medical home, and the more information we have, the better. Sometimes what can happen is, if for all the sick visits that come up, if a child's going for perhaps to an urgent care and then an ER and then a different urgent care, and that information doesn't get back to your medical home, I worry that nobody's looking at the big picture. So maybe, for example, a child had an ear infection and was seen at one place, and then another ear infection seen at another place, and another one. And if nobody knows or is looking at the big picture, they may not pick up on maybe some issues or something else that needs to be addressed. So again, the more the child is seen in the same place, the more we can have a comprehensive understanding of what's going on with your child. So fragmented care, I think, is not good for lots of different reasons. And I would just encourage you to kind of keep that in mind. And again, if you take your child to an urgent care emergency room the next day, or as soon as you can, just let your pediatrician's office know. The more information we have, absolutely the better. And then the last thing I wanted to mention is resources for people who do not have insurance. And that's honestly, I mean, it's tough, and it shouldn't be so tough, but it is. Now, I feel fortunate in the sense that as a pediatrician, most children should be or eligible for Medicaid. I hate to put it that's not completely accurate, but many children are, I should put it that way. And so I would just encourage you, if you have questions about whether or not this is something that would be an option for your child, I just wanted to put the website here. I think there's a lot of good information there. But in terms of where to take your child if you do not have insurance, I think that our federally qualified health centers and our community health centers are extremely good options. These clinics often are either, in my experience, most of them have a sliding scale. Some may be free, but what a sliding scale means is that they look at your income and your resources, and then they determine the fee for the visit based on that. And many of the, we call them FQHCs, have not just medical care, many of them also have dental care, many have behavioral health, and some even have pharmacies. So they can be an incredible resource for you. And these two websites here, I think, are pretty good in terms of finding out where these clinics are. You can search by just state, county, zip code, that type of thing, and they'll show you a map of all the clinics that are, you know, anywhere even close to where you live. And I think that can be an incredible resource for you. So I think that pretty much covers it. I hope I enlightened you a little bit about what all goes into a well child visit and really the importance of having that medical home for your child. But I'm happy to take any questions.
Thank you. And you guys can feel free to unmute yourself and ask a question, or type it in the chat box if you have one.
I can stop sharing so I can, wait, no. I stop sharing. Oh, there it is.
I actually had a question. When it came to the fluoride, so if we just take them for a well child check, we can ask them to do that as well?
So not everybody does it. It's something that if we go through just a little bit of training, it really doesn't take much. Pediatrician, it can be done in the pediatric office. So I would inquire as to whether or not that's something that's offered at your pediatric office.
Okay.
I think it's being recognized how helpful it could be if it was done in that way. And so more people are trying to offer that in their clinic setting.
Awesome.
I think the more we can consolidate all of these things, the better. I was talking with someone recently who actually one day a week they have a dental chair in their clinic, and they provide dental services in the pediatric clinic. Isn't that cool? Isn't that a great idea? Because as parents, we are so busy. And I think the hardest thing is just finding the time to take our children for all the different things that they need. And the more we could put everything in one place, I think the better we would be. And I saw the fluoride, it's starting, I believe it's at 6 months as soon as the child has teeth. And it's every 3 to 6 months up through the age of 5 or 6, I believe. I'm gonna double check that. So it starts pretty young and goes all the way up through 5 or 6. And it's just another measure, 6 months. It's just another measure to help prevent caries. So putting that fluoride right in the teeth can be very helpful to prevent dental cavities.
Dr. Hartford, you mentioned earlier about the Bright Futures book.
Yes.
Is that a book that is available to purchase? Can you find that somewhere?
Yes, I will look and send you a link. I know that they have it on the American Academy of Pediatrics website. It's aap.org. But I can look it up for you and send you the link.
Thank you. That'd be great.
Yeah. It has so much good information in there. It goes over not only just, you know, the different elements of the exam, all the things that I went over, but all the different educational things that should be covered at every single age, questions to ask, what our focus should be in terms of what could be going on with the family. It's a really great resource.
Yeah, that sounds like a great resource for parents who have some questions and want to keep something handy to check into.
Yeah, I will send that to you.
I have a question. I know just from previous conversations with some families, sometimes they don't know if they're able to switch from the pediatrician that they've been going to for a while, but just don't feel comfortable with. What would that process be like if your child had been with the pediatrician for a year, you tried it out for a year, you didn't really care for them, and you wanted a different medical home? Would they
Mhm.
be able to transfer their medical records or?
Oh, yeah, that's very simple to do. Some of that is constrained by your insurance and who it belongs to your insurance plan. But yeah, as far as medical records, it should be easy. So when you go to a new office, what we usually do is find out who your last physician was and then request the records from them. So we just have you, fill out a release of information and send that over. And some of that is a little bit easier with electronic medical record. So, switching doctors, it is something you should always be comfortable with your medical home. No question about it. Yeah. And did that answer your question? It's not that complicated at all from our standpoint. From the insurance standpoint, it might be a little more complicated. And then question for why stopping head circumference at 2 years of age? That's just the most rapid period of head growth, and then it usually slows down. So it's not so much that we might not ever check it again if we were concerned, but it's just, that's the time where that part of the body grows the most, and so monitoring it during that time frame just helps us know if we're on the right track. The growth of the head really slows down after 2 years of age.
Do we have any other questions? We have some good ones so far.
I have one more for you, Dr. Hartford.
Okay.
About lead screenings versus lead testing. We get a lot of well child checkups back, and we do not see, I know it's required by the EPSDT that they do blood test levels, but we're not getting those back, and they're just pediatricians are doing the screenings. So how do?
Yeah, so you mean just asking the questions?
Yes.
Yes, and there is the option to do it that way. It really is, if you read down into the details, you're right, it is part of the EPSDT. So I think most of us are just used to doing it as part of that evaluation. If you read down into the details of the AAP recommendations, they do say that you can assess a child's risk, and if you feel that they are low risk, then you don't necessarily have to do it. It depends on your patient population and the risk for exposures. So if you are, if you're just concerned about your patient population as a whole, then some practices will screen everybody. But yeah, that would be my guess, is why you may not be getting the lead levels for every child. But I hope that those appropriate questions are really being looked at to make sure that the child does not fall into a risk category. Although, I think the example of Flint, Michigan and what happened a couple of years ago is a perfect example of, we just need to be careful.
Thank you for that clarification. Thank you for that.
Yeah, I'm guessing that's why.
And I just had one more question, just because I was reading about this topic just the other day. I was happy to hear that they're wanting to do more screenings as far as postpartum depression with moms,
Yes.
To extend that out. What should a mom do if they're with their baby at the visit during that time frame where they're really, trying to hone in on that, but she isn't asked anything about herself, her mental state? If she goes ahead, can she just go ahead and say, well, Timmy is doing all right, but I'm just feeling like
Yes.
sad, and what service could she expect from that? Would they just tell her to, well, go see your doctor, or will they be able to provide her with anything?
Yeah, it's please tell that to your doctor if that's something you're struggling with and they're not specifically asking you. We use something, it's called an Edinburgh. I don't know if you've ever heard of that, but it's a specific questionnaire that specifically asks about postpartum depression, specifically asks questions directed at postpartum depression, and that's the only thing it's used for. But if you are a mom who struggles, yes, just tell your pediatrician that that's something you're struggling with. What I do is I try to help them. There are several options. What I try to do is directly hook that mom up with a mental health provider, which sometimes is not as easy as we would hope it would be, but that would be the ideal. So for us on our end to be familiar with the services that are available in our area, so that for those moms, we can help connect them as well as we can. I would say if that's not going to happen, then getting that mom into her own physician as soon as possible for maybe some potential medication treatment would be the next best thing. And then also just talking with her about who are her supports at home, maybe giving her some suggestions of things that might be helpful to her. Some moms are just so overwhelmed, making sure that baby's truly safe, making sure she understands that she should take a break and find somebody to help her so that she can take those breaks at those times that she needs them.
Oh, good.
Yeah.
Thank you. All right. Anyone else have anything? All right then. Well, I would personally like to say thank you to everyone here. Thank you, Kim. She said, thank you for the presentation. We thank you for joining us. Um, and thank you to all of you in here. And especially thank you to Dr. Hartford for taking some time out your day. She is also a member of our Health Services Advisory Committee. We truly appreciate you volunteering your time to assist us in educating our family and community on these important topics.
My pleasure. I loved being here. Thank you so much. This was fun.
And we have recorded this session, so we will be within the coming days uploading it. So if you just wanted to watch it again, if you're like, hey, what was that link? You can rewatch the video as well and share it with your friends if they weren't able to attend tonight. So.
Thank you very much.
Thank you, everyone.
Have a great night, everyone. Bye.